Far Side tonight, digging deeper into skyrocketing pay for those who run some of the state's biggest nonprofits, our hospital systems. On average, 20% of what you make goes to pay for health care costs. Nearly 40% of Americans say they have cut back on food, utilities, or gas to pay a medical bill. It's why a new report highlighting that nonprofit hospital CEO pay doubled in the last 5 years is getting so much attention. Good evening, and thanks for staying with us here at 7:30. You know, we've heard the stories, right? Families right here in our area crushed by the weight of hospital bills. 1 in 5 are in medical debt collections. WBTV investigative reporter David Hodges has talked to many of them.
You've told us about astronomical bills.
And they said $45,000 originally. And it was kind of like a phone drop moment.
Lawsuits filed by hospitals.
We do not need a judgment. Can't afford a judgment and can't afford all of that money either.
How hard it is to escape the crushing weight of medical debt.
I can't even put a number on it, but at some point I did file bankruptcy.
Some of David's reporting last summer. Now, North Carolina Treasurer Dale Folwell has been hot about this issue. His office has been cranking out research-based reports critical of how our nonprofit hospitals are doing their business. And CEO pay is the latest target in this. The Treasurer's report found between 2010 and 2021, the state's 9 largest hospital systems spent $1.75 billion on top executive compensation. Atrium Health spent $310 million of that, and CEO Gene Woods made $9.8 million in 2021 alone. His pay has increased 473% over 6 years. In the 10 years between 2010 and 2019, nurses' pay went up just 15%. Treasurer Folwell stopped by our studio earlier today. Treasurer Folwell, I appreciate you coming by and talking to us. I'm curious, what irritates you most about the findings in this report?
What irritates me most is the wide gap between what these millionaire executives make who work at these corporations who are disguised as nonprofits when they're having trouble actually attracting nurses in order to get people the quality of care they deserve.
Let me ask you about Atrium Health.
Sure.
And obviously we've seen the salary increases with Gene Woods, and they said in a statement, as a nonprofit health system, we don't have the luxury of providing stock options and other typical corporate perks. We're proud of how our executive leadership team, including our CEO, strategically led this entire region through a global pandemic without any layoffs or rural facility closures.
Right. Well, that's their job. I mean, the fact is that we don't know what their outside compensation is because we don't know what stock options they might be getting from sitting on other boards. And we found that out at UNC Healthcare, where the head of UNC Healthcare was making millions and millions of dollars sitting on a publicly traded board. And specifically to that statement, I mean, your viewers need to look forward to what's probably getting ready to happen to executive pay for Atrium, given the fact that the company they just merged with in the Midwest is one of the biggest offenders there is as far as executive pay.
Does it bother you that Atrium is also now going to be opening up a medical school here in the city of Charlotte with a mixed-use development? Is that getting away from their mission in your view?
Absolutely. I mean, Atrium has lost its mission. They used to be, they've turned into an investment banking, stock trading company that happens to be in the medical services. I mean, we're talking about Gene Woods saying this nonprofit. I don't think any of your viewers consider a company that has $13 billion in the bank to be nonprofit.
You pointed out in your news conference yesterday that you think the hospital systems and the way it is set up right now are violating the state constitution. What do you mean by that?
Well, the state constitution in section 34 says that monopolies and perpetuities are against the free will of society. We all know what we see, and we know how we feel about what we're seeing, about the power of health care in the hands of fewer and fewer people. I'm easily satisfied on this topic, Jamie. Just show people what things cost. We attempted to find out what we were paying for health care as the largest purchaser of health care, and this is what was returned to me as the state treasurer.
Blank pages.
Yes. Tell people what things cost. Offer a level of charity care equal to the billions of dollars of tax benefits you get, and stop weaponizing and breaking people's kneecaps if they don't pay their bill. That's all we want.
What are we supposed to do with this information? Is there a legislative fix to some of these things you're talking about?
Atrium is owned by the County of Mecklenburg. The County of Mecklenburg needs to change its charter so that they can appoint people to the Atrium Board that they want to appoint. If my memory is correct, the chair of the Mecklenburg County Commission can only appoint from names that are submitted to him. So what kind of names do you think Gene Wood's going to submit to him? The ones that give him tremendous pay increases. You know, the County of Mecklenburg deserves, the citizens deserve a dividend off this multi-billion-dollar corporation called Atrium, just like the Duke Power stockholders do.
But how do we set their pay then? What do you want to see?
Well, I think the pay should be set on higher quality and higher access and lower cost. What have you done to make health care better? What have you done to make it more accessible? And what have you done to lower the cost?
Treasurer Falwell with us earlier today.